Somewhere along a dirt road shoulder, in a forgotten corner of an old property, maybe right in your own backyard, some of the most powerful medicines humanity has ever known are still growing. Plants your grandparents knew by heart. Plants that saved soldiers on battlefields, that healed people for centuries when there were no hospitals, no pharmacies, nothing but the earth and what grew from it. While we rush to the drugstore for every cut, every cough, every ache, these plants keep growing everywhere. For thousands of years they healed people, and many of them now have confirmed clinical evidence behind them. 20 plants the world forgot, but that never stopped working. From impressive to absolutely incredible. Calendula, the war flower, a bright orange flower with one of the most battle-tested reputations in herbal medicine. Medieval soldiers carried calendula blossoms into war, specifically to treat cuts and wounds on the battlefield. They called it the war flower because when there was no surgeon, no antibiotics, no sterile equipment, calendula kept a wound from going septic and helped it heal clean. Calendula officinalis grows easily in almost any garden. Cheerful orange and yellow blossoms from spring through first frost. But those pretty flowers are a medical powerhouse. Modern clinical trials proved what medieval warriors already knew. Calendula extracts accelerate wound healing, including burns and post-surgical wounds. Studies show it stimulates tissue repair and reduces inflammation. The flowers are packed with triterpenoids and flavonoids, compounds with confirmed anti-inflammatory and antimicrobial properties. A simple salve from dried flowers infused in oil, and you have something that heals minor cuts, scrapes, burns, and inflamed skin faster than leaving them alone. Calendula was forgotten for a simple reason. Pharmaceutical companies cannot patent a flower. But for anyone who needs safe, effective wound care without a prescription, calendula is still waiting in gardens everywhere. The emergency room in your backyard that has been there all along. Sea buckthorn, the Himalayan skin healer. Sea buckthorn may be the most forgotten superfood medicine on the planet. A spiny shrub with bright orange berries used for centuries in Tibetan, Russian, and Chinese traditional medicine, specifically for healing skin and mucous membranes. And modern science has finally caught up. Hippophia rhamnoides produces berries so rich in vitamins, antioxidants, and omega fatty acids that Russian cosmonauts used sea buckthorn oil in space to protect against radiation damage. Recent human studies show sea buckthorn oil improves skin barrier function, accelerates wound healing, and helps with dry, inflamed mucous membranes. From dry eyes to inflamed tissue throughout the body. The oil from both berries and seeds contains a rare omega-7 fatty acid that supports mucous membrane health across your entire system. Clinical trials documented improvement in dry skin, eczema, atopic dermatitis, dry eye syndrome, and vaginal dryness after menopause. Sea buckthorn vanished from Western medicine simply because it grows in harsh, remote climates, the Himalayas, Siberia, high mountain regions. But you can grow it in cold climates, and the oil is available as a supplement. For anyone fighting chronic, dry, inflamed skin, sea buckthorn does what most moisturizers only promise. It actually heals from the inside out. Comfrey, the bone knitter. Comfrey has one of the most telling folk names in all of herbal medicine, knit bone. For centuries, people applied comfrey root and leaves externally to broken bones, sprains, bruises, and torn tissue. They swore healing happened faster. Turns out they were absolutely right. Symphytum officinale contains a compound called allantoin that stimulates cell proliferation, literally encouraging cells to multiply and repair damaged tissue faster. Multiple modern clinical trials proved it. Topical comfrey root extract significantly reduces pain and improves function in back pain, ankle sprains, abrasions, and osteoarthritis. Peer-reviewed, published studies. The important part, comfrey is for external use only. The plant contains pyrrolizidine alkaloids that can damage the liver if taken internally. But as a salve, cream, or poultice on skin over an injury, it is remarkably safe and effective. A simple salve from dried root infused in oil with beeswax added. Comfrey was forgotten partly because of the internal use concerns, partly because modern medicine decided broken bones needed casts and x-rays, not herbs. But for the soft tissue injuries that happen constantly, sprained ankles, strained backs, bruised muscles, comfrey remains one of the fastest natural healers on earth. Mullein, the lung cleaner. A tall plant with fuzzy leaves and a spike of yellow flowers. You have almost certainly seen it growing on vacant lots and along roadsides. For hundreds of years, it was the go-to remedy for any kind of lung congestion. Coughs, bronchitis, asthma, chest colds with thick mucus. Verbascum species were used so commonly for respiratory problems that herbalists called mullein the lung's best friend. The leaves contain saponins, natural expectorants that help you cough up mucus instead of letting it sit in your chest and turn into an infection. Modern reviews confirm anti-inflammatory and antimicrobial effects on the respiratory system. The traditional method, tea from dried leaves, strained carefully through cheesecloth to remove tiny hairs 2 or 3 times a day during a chest cold. The flowers were also infused in oil for ear infections. Mullein fell out of use when commercial cough syrups and decongestants arrived, but those often just suppress the cough without actually helping clear the infection. Mullein helps your lungs do what they are trying to do, get the junk out, without the side effects of pharmaceutical drugs. Plantain weed, the trailside first aid kit, the plant that literally everyone has walked past 1,000 times and never noticed. Plantain weed, not the banana-like fruit, the low-growing weed with oval leaves and thin flower spikes. It grows on lawns, trails, disturbed soil, everywhere. One of the most reliable first aid plants on earth. Plantago major was called white man's footprint by Native Americans because it seemed to grow everywhere European settlers walked. But they quickly learned this humble weed could treat cuts, burns, insect bites, and infections better than almost anything else available on the trail. Modern research backs this up completely. Plantain has genuine wound healing, anti-inflammatory, and antimicrobial properties. A clinical trial in Iran found that plantain ointment improved healing of second-degree burns better than standard treatment. The leaves contain compounds that soothe inflammation, stop minor bleeding, and fight infection. The traditional method: take a fresh leaf, chew it briefly to break down cell walls, or just crush it and apply directly to a cut, sting, or bite. Within minutes, pain and swelling begin to decrease. You can also make a strong tea of dried leaves to wash wounds. Plantain was forgotten because it is a weed, common everywhere. We have been trained to think medicine should be rare and expensive, not growing in the cracks of our sidewalks. But for minor injuries and insect stings, it is immediate, free, and incredibly effective. Yarrow, the soldier's herb. Yarrow contains compounds that genuinely shorten bleeding time and promote clotting. Studies show it has hemostatic effects. It stops bleeding, plus anti-inflammatory and wound-healing properties. Soldiers throughout history carried dried yarrow to pack into wounds, and for good reason. It worked. Achillea millefolium grows wild across North America and Europe. Clusters of tiny white or pink flowers on tall stems. The whole aerial part of the plant is medicinal. A tea for internal use reduces fever and inflammation. Crushed fresh leaves applied directly to cuts and scrapes stop bleeding and prevent infection. Yarrow is both a hemostatic and a vulnerary. It stops bleeding and heals wounds. Most plants do one or the other. Yarrow does both. Traditional herbalists also used it for fevers, digestive complaints, and as a bitter tonic. It was forgotten simply because synthetic clotting agents and antiseptics were developed. But for anyone hiking, camping, or working outdoors, knowing that yarrow grows nearby and can stop a bleeding cut in minutes is genuinely valuable knowledge. Self-heal, the appropriately named miracle. The plant is literally called self-heal, or heal all. That tells you everything about how our ancestors viewed it. Prunella vulgaris was used for virtually any kind of wound, sore throat, mouth ulcer, or inflamed tissue. People trusted it enough to give it the most confident name in herbal medicine. Modern research is validating that confidence. Reviews show self-heal has genuine wound-healing properties, anti-inflammatory effects, and even disrupts bacterial biofilms, those protective layers bacteria create to make infections harder to treat. It grows low to the ground in lawns and meadows, purple flower spikes that bees love. The whole plant is medicinal. A strong tea works as a mouth rinse for canker sores and sore throats. Crushed fresh leaves go on minor cuts and scrapes. Self-heal works on mucous membranes particularly well. That means mouth ulcers, sore throats, inflamed tissue in the mouth and throat, places where applying medicine is tricky. A simple tea used as a gargle can bring relief within hours. It disappeared from mainstream use simply because it is another common weed that the pharmaceutical industry could not monetize. Agrimony, the throat soother. A plant that medieval herbalists absolutely loved, particularly for anything involving the mouth, throat, or digestive tract. Agrimonia eupatoria produces tall spikes of tiny yellow flowers and has a long history as a gargle for sore throats and a tea for mild diarrhea and digestive upset. Reviews of traditional use describe agrimony water extracts for airway inflammation, pharyngitis, tonsillitis, laryngitis, as well as urinary problems, digestive issues, and chronic wounds. The plant contains tannins with natural astringent properties that tighten and tone inflamed tissue. The traditional method. A strong tea of dried aerial parts gargled several times a day for sore throat and mouth inflammation. The same tea could be drunk for mild diarrhea. The astringent tannins help tone the gut lining. Agrimony grows wild in meadows and along woodland edges. The taste is mild, slightly bitter, actually quite pleasant. It was forgotten because modern medicine offers more aggressive treatments for throat infections, and people stopped making herbal gargles. But for mild sore throats, especially the kind that comes with post-nasal drip and irritation. Agrimony is gentle, effective, and soothing. White Horehound, the original cough drop. Before there were cough drops, there was horehound candy. Merubium vulgare was so effective for coughs that people literally made it into candy and lozenges. Sold in every pharmacy and general store well into the 1900s. Horehound is a classic expectorant. It helps you cough up mucus and clear congestion. Herbal monographs describe it for productive coughs and bronchitis. It is still used in some European cough syrups and throat lozenges today. The plant contains a compound called merubium that stimulates bronchial secretions and helps break up congestion. A bushy perennial with fuzzy gray-green leaves and small white flowers. Traditionally, people made a strong tea sweetened with honey, or they made actual horehound candy by boiling the tea down with sugar. The key difference from cough suppressants: horehound does not stop your cough. It makes your cough productive, helps you actually clear the infection out of your lungs instead of just suppressing the symptom. Real healing, not symptom management. White Horehound disappeared when synthetic cough medicines took over the market, but those often come with side effects and do not necessarily help you heal faster. Boneset, the flu fighter. Now we are getting into the truly powerful ones. Eupatorium perfoliatum was so famous as a flu remedy in the 1800s that practically every household kept dried boneset on hand for when the inevitable fever and body aches hit. It was called boneset because the deep muscle aches of flu were called break-bone fever, and this plant seemed to cure them. Boneset was one of the most important medicines during the great influenza epidemics of the 19th century. A hot tea of dried leaves and flowers at the first sign of flu, fever, chills, deep aching, exhaustion. Ethnobotanical sources describe it as a febrifuge and immune stimulant. It grows in wet meadows and along streams, flat clusters of white flowers in late summer. The tea is incredibly bitter, one of the most bitter in herbal medicine. But that bitterness was seen as part of what made it work. The traditional approach, at the very first sign of flu symptoms, drink a hot cup of boneset tea, get into bed, and sweat it out. The plant seems to help the body mount an effective fever response, an immune reaction. Many people swore it could stop a flu in its tracks if caught early enough. Boneset was forgotten as vaccines and antiviral medications became available. But for the ordinary flu-like illnesses that still hit us regularly, it remains a powerful traditional remedy. Blue vervain, the nerve soother. Blue vervain has one of the most interesting traditional uses. It was considered a nervine, a plant that calms and strengthens the nervous system. Verbena hestata and its cousin, Verbena officinalis, were used for nervous exhaustion, anxiety, tension, headaches, and insomnia. All the stress-related problems we are dealing with more than ever today. Traditional herbalists described vervain as a remedy for people who are wound too tight, overthinking, tense, unable to relax or sleep. Modern herbal sources and some animal research suggest vervain has genuine anxiolytic, anti-anxiety effects. It helps calm nervous tension without sedating you. It grows wild in wet meadows and ditches, tall spikes of tiny purple-blue flowers. The tea is quite bitter, so it is often combined with more pleasant herbs or sweetened with honey. A cup of vervain tea in the evening to let go of the day's stress and prepare for sleep. Or during the day for people dealing with nervous tension and anxiety. It does not knock you out like sleeping pills. It just helps your nervous system relax and reset. Vervain was forgotten when pharmaceutical tranquilizers and sleep aids took over the market. But those often carry dependence, side effects, and rebound problems. Vervain offers a gentler approach for mild to moderate stress and tension. Elecampane, the deep lung tonic. Elecampane is where herbal medicine gets serious about respiratory healing. Inula helenium was the remedy herbalists reached for when someone had a deep, stubborn lung infection, the kind of wet, productive cough that just will not quit. Chronic bronchitis, lingering chest congestion after pneumonia. The root contains sesquiterpene lactones, compounds with antitussive and antimicrobial effects. Reviews describe it for chronic cough, asthma, and lung disease. Recent research confirms antimicrobial activity against respiratory pathogens. A tall perennial with huge leaves and sunflower-like yellow flowers. The thick roots are harvested in fall, dried, and used in decoctions, long-simmered teas, or tinctures. The taste is complex, slightly bitter, warming, aromatic. The traditional approach. For deep lung problems, small, frequent doses over weeks or even months. It is not a quick fix. It is a deep lung tonic that helps the respiratory system heal and strengthen. Herbalists often combined it with other lung herbs for stubborn respiratory infections. Elecampane fell out of common use partly because it requires patience. It works slowly and deeply rather than giving instant relief. Partly because antibiotics seemed like the faster solution. But for chronic, lingering respiratory weakness, elecampane offers something antibiotics do not: genuine healing and strengthening of lung tissue. Toothache plant, the instant numbing herb. This one lives up to its name in the most dramatic way possible. Spilanthes, or Acmella species, contain a compound called spilanthol that creates an instant tingling, numbing sensation in your mouth. Chew a fresh flower or leaf, and within seconds, your entire mouth goes numb. Traditional healers use this for exactly what you would expect: toothaches, but also for mouth ulcers, sore throats, and any painful oral condition. Reviews confirm local anesthetic and analgesic effects. It is still used in some traditional medicine systems for oral pain today. A small annual with yellow and red cone-shaped flowers that look like tiny rockets. The flowers have the strongest numbing effect, but the leaves work too. It grows easily in warm climates or containers. At the first sign of tooth pain or mouth ulcer, chew a fresh flower or leaf and let it coat the painful area. The numbing effect is immediate and can last 30 minutes or longer. It does not cure the underlying problem, but it gives genuine pain relief while you address the cause. Toothache plant was forgotten in the West simply because commercial numbing gels appeared. But the effect is so strong and immediate that first-time users are always stunned. Oregon grape, the skin healer. Oregon grape is not actually a grape. It is a spiky-leaved evergreen shrub with yellow flowers and blue berries. But Mahonia aquifolium has something genuinely special. It is one of the few herbs with solid clinical evidence for treating chronic skin conditions like psoriasis. Multiple studies have shown that topical Oregon grape extract significantly improves psoriasis and atopic dermatitis symptoms. The plant contains berberine and other alkaloids with antimicrobial and anti-inflammatory effects on skin. Traditional use included both topical application for skin problems and internal use for digestive issues. The bright yellow inner bark of roots and stems is the medicinal part. You can make a salve or cream or find commercial Oregon grape products specifically formulated for psoriasis. The effect is not instant. You need to use it consistently for weeks, but the improvement can be significant. Psoriasis and eczema are chronic, frustrating conditions that do not respond well to most treatments. Oregon grape offers a botanical option with actual clinical backing. Not just traditional use, modern studies with real results. It was forgotten simply because it grows in the Pacific Northwest and was not widely available elsewhere until recently. Yellow dock, the liver and digestion ally. Yellow dock is one of those herbs old-fashioned herbalists called blood purifiers. What they really meant was herbs that help your body process and eliminate waste more efficiently. Rumex crispus root has been used for centuries for sluggish digestion, constipation, and skin problems connected to poor elimination. The root is rich in bitter compounds and anthraquinones that stimulate bile production and digestive function. Modern herbal reviews link yellow dock with supporting liver function, improving digestion, and helping with chronic skin issues that respond to better internal cleansing. A tall weed with a deep taproot and reddish seed heads. The root is harvested in fall, dried, and used in small amounts in tea or tincture. The taste is quite bitter and astringent, and that is part of what makes it effective. The bitterness triggers digestive responses. The traditional approach. Small, regular doses of yellow dock root to improve digestion, relieve constipation, and support the liver's detoxification work. Over time, many people found that stubborn skin problems cleared up as digestion improved, because skin often reflects internal health. Yellow dock was forgotten when laxatives and liver medications became the standard approach, but those often force the body to respond rather than supporting natural function. Yellow dock works more gently, helping your body do what it is supposed to do. Usnea, the wilderness antibiotic. Usnea is technically not a plant. It is a lichen that grows hanging from trees like pale green hair, which is why it is called old man's beard. But this humble lichen has remarkable medicinal properties that make it one of the most important wilderness first aid remedies. Usnea species contain usnic acid and related compounds with strong antimicrobial activity. Modern reviews show effectiveness against bacteria, including some antibiotic-resistant strains. Traditional use was primarily topical, crushing fresh usnea and applying it to wounds and infections, or making a tincture for use as an antiseptic wash. You can find usnea hanging from trees in relatively unpolluted areas, especially in the Pacific Northwest and mountain regions. It grows slowly and should be harvested sustainably. Take only what has already fallen, or clip small amounts from healthy trees. For best medicinal effect, prepare as an alcohol tincture. The traditional wilderness use: you cut yourself on a hike and have no first aid supplies. Fresh usnea can be moistened and applied directly to the wound as an antimicrobial dressing. Modern research confirms this was not wishful thinking. It genuinely fights infection. Usnea was forgotten simply because it is a lichen, not a plant, and it does not grow everywhere. But for anyone who spends time outdoors, it is an antibiotic that grows on trees. Barberry, the ancient antimicrobial warrior, a plant that has been used for over 2,000 years, and modern science has finally proven it works against antibiotic-resistant bacteria. Berberis vulgaris contains an alkaloid called berberine, one of the most studied plant compounds in modern medicine. Berberine has documented antimicrobial effects against bacteria, fungi, and parasites. Anti-inflammatory effects. It supports digestive health. Proven help with diarrhea, especially infectious diarrhea. Recent research even shows metabolic benefits, improved blood sugar control, and cholesterol levels. Traditional use goes back millennia. Barberry appears in ancient Persian, Ayurvedic, and Chinese medicine. The bright yellow inner bark of roots and stems contains the highest concentration of berberine. It can be prepared as a tea, tincture, or concentrated extract. The taste is intensely bitter, and that is part of what makes it effective for digestion. Barberry is one of those rare plants where traditional use and modern science align perfectly. Ancient healers used it for digestive infections, liver problems, and inflammatory conditions. Modern research confirms antimicrobial, anti-inflammatory, hepatoprotective, and metabolic effects. Barberry was forgotten in the West partly because the shrub is thorny and aggressive, partly because synthetic antibiotics seemed more reliable. But with antibiotic resistance becoming a serious problem, berberine-containing plants like barberry are getting a second look, the ancient medicine becoming cutting edge again, because we are running out of alternatives. Red clover, the field medicine flower. Red clover is so common that most people think of it as just another lawn weed. But Trifolium pratense has been used medicinally for centuries, particularly for skin conditions, inflammation, and women's health issues. Recent studies have validated several traditional uses. Red clover contains isoflavones, plant compounds with mild estrogenic effects. Research shows benefits for menopausal hot flashes. Traditional use includes topical application for skin healing and internal use for chronic skin conditions like eczema and psoriasis. The flowers also have anti-inflammatory properties. You can harvest the flower heads from clean areas, not treated with chemicals, dry them, and make tea. The taste is mild and slightly sweet. Some people also make infused oils for topical use on skin problems. The traditional approach. Red clover was often used long-term for chronic conditions. Weeks or months of regular tea for skin problems or menopausal symptoms. Not a quick fix. A gentle, nourishing medicine that supports healing over time. Red clover was forgotten simply because it is everywhere and common. We have been trained to think real medicine should be rare and exotic, not carpeting every meadow in the country. Sassafras, the historical fever fighter. Sassafras has a complicated history. Native Americans used sassafras root and bark for fevers, rheumatism, and digestive problems. It was later used commercially to flavor root beer. The roots have a distinctive spicy aroma and were considered valuable medicine for hundreds of years. Traditional uses included fever reduction, treating rheumatic pain and inflammation, and digestive complaints. The plant contains aromatic oils with warming, stimulating effects. However, and this is important, sassafras contains safrole, a compound shown to have potential liver toxicity and carcinogenic effects in large amounts. The cause of this, internal use is now restricted in many countries. Sassafras today is mostly historical. Interesting to know about, understand in context, but not recommended for regular internal use, given safety concerns. The traditional uses were real, and the plant was genuinely valued. But we now know enough about the chemistry to be cautious. This is a good example of how traditional medicine and modern science work together. Traditional use tells us what to investigate. Modern research tells us how to use it safely, or when to find alternatives. Sassafras is part of medicinal plant history, and a reminder, natural does not always mean safe for regular use. Meadowsweet. The original aspirin. The one saved for last, because it represents everything we have talked about today. Philopendula ulmaria is the plant that aspirin was based on. Before synthetic aspirin existed, people used meadowsweet for pain, fever, inflammation, and, interestingly, stomach irritation. The history is remarkable. Meadowsweet contains salicylates, the same compounds aspirin is based on. When chemists first synthesized aspirin, they derived it from salicylic acid found in plants like meadowsweet and willow bark. But here's the twist. Meadowsweet does not cause the stomach irritation that aspirin often does. In fact, traditional herbalists used it specifically to soothe stomach inflammation, while relieving pain and fever at the same time. The flowers and leaves are harvested and dried for tea. The taste is pleasant, slightly sweet with an almond-like aroma. Studies confirm anti-inflammatory effects from the salicylates and other compounds. Traditional use included tea for headaches, arthritis, pain, fever, and digestive discomfort. Meadowsweet grows in wet meadows and along streams. Creamy white clusters of fragrant flowers in summer. It has been used in Europe for centuries. One of the most important pain-relieving herbs before modern pharmaceuticals existed. Meadowsweet shows how we took nature's medicine, isolated one compound, synthesized it, and somehow ended up with something less balanced and more problematic than the original. The whole plant offers pain relief without the stomach damage that isolated aspirin causes. That is the genius of plant medicine. Nature's formulations are often better than our attempts to improve them. Meadowsweet was forgotten because aspirin became cheap, standardized, and available everywhere. But for people who cannot tolerate aspirin's stomach effects or who want a more balanced approach to pain and inflammation, meadowsweet is still growing in ditches and meadows, still relieving pain, still doing what it has done for thousands of years. The original medicine, waiting patiently for us to remember that sometimes the natural version really is better than the synthetic copy.